quite exhaustively. He's done very well. Now
So I
we
think
are
Okay,
all
sir.
waiting to hear you. Please proceed.
Okay, sir. Okay,
With
then I
full
will
of
start with
clarity,
the
Raman.
screen sharing.
You gave
Yeah.
with full clarity.
yeah, can share the screen.
Yeah, yes, sir.
In the meantime, if the audience has any doubts, kindly put in the chat box. Okay, that means we'll take it up towards the end of the session. If anybody has any chats, any concerns or doubts so far.
Okay, you are able to see my slides, sir?
Yeah,
Yes.
very well. I can
Okay, fine.
hear and see also, Mahendra.
Okay, fine. So coming to the point, slightly starting with that, why do we require a PP? We all know we are just dealing with an aerosols. All of you would have seen. I would like to start by showing you your image. If you consider like this is routinely how most of us are practicing all this time. Of course, still people would have got a better protective equipment also. This is like a study done by Crawford, which tells like. Where all the splatters are going to be there. If you are going to use a poster paint in the patient's mouth, just demonstration, it clearly shows where what all areas, what all the unexpected areas where the splatter is going to spill. If you are consider if there is some radiographic glow for the splatter, these are the areas. The unexpected areas I would like to point out: the neck of the operator, operator's face, forehead, chest, arm till the elbow. You can see even the shoulders got few splatters near the hip, thighs, because thighs they are very closer to the patient's chest, wherever the aerosol depositing over there. Even the assistant shoulders, arms, neck, and you could see the images on the right bottom. There the area between the goggles and the mask where the nose and the thin strip of the layer is exposed may gets a good amount of splatter, and this person is not wearing a head cap. The hair and other things will have enough amount of splatter which is deposited over there. So the consideration is, after removing this kind of routine PP, if you happen to touch the face or touch the hair, we are going to have the contamination. So this is the essential situation which warrants to have a full cover PP with the hood. So what is the purpose of the hood? Generally, we would have been, all of us would have been seen in this COVID times. See, it is to prevent the spray in the forehead, neck, and all other regions, and to prevent the aerosol from entering below the mask and other regions. So that is a requirement where we are going to go with it. So firstly, I would like to start with the continuation of the previous things. First is determining the glove size. Like if you are taking a glove, how to determine? See, each of us have a different sizes. We would have done with the trial and error by now. All of us would know our size, but there is a particular method to do with it. We need to measure the circumference of your dominant hand just below your knuckles. Compare the measurement to the size chart below to find the glove size. A good fitting gloves always help you to become less tiresome and will have a better grip and maneuverability in handling things. So that's how it is done. So by some of the glove boxes have a markings where you can keep your palm over there, and then you can measure the distance and it will directly tell these values. So that's how it go with it. So you can try. I think these images are easily available in the net. You can take up or you can take a screenshot. So there are some mention about the double gloving techniques. If you are using a double gloving, so there is a small recommendation. You need to wear the smaller size glove first and then wear the bigger size glove over that. For example, if my glove size is 7.5, I need to wear the 7 glove first and then wear the 7.5. The reason is, if you wear the bigger gown first, so for example, if you think like I will put a 7.5 and a 8, that doesn't work. The gloves will be slippery. So in order to have a tight adaptation, we need to wear the smaller size and then go for the regular size. That's the best recommendation. And I would like to have a smaller video which shows it's like a routine examination glove we are using there. So we cannot use sterile glove for all the procedures, but we easily available this examination glove can be autoclaved and used for variety of situations. Maybe you can use a double glove or something. Here's a small technique where the regular examination glove can be rolled and can be autoclaved and used. So sorry. Here we will play it. I will play it little faster for the paucity of time. So before making this procedure, we would like to do a hand disinfection method, so that like whatever we are handling the glove will remain sterile, will remain in a best asepsis possible way. Okay, you can see here, take 2 examination gloves, keep one over the other. start rolling from the tip. Keep two gloses. So I prefer to keep two gloses together so that once you pick up, you will have two gloses for both your hands. With the fin or the with the cuffed edge of the outermost glove, cover it, roll it, and keep it like this. And you collect all the gloves like that. The next step is you need to take a bin, autoclaving bin, or keep a gauze pad inside that, or you can keep a cloth inside that and keep all the gloves. And you can put name it what size of the glove is there, and regularly keep it for autoclave, and then you can use it. So once autoclaving is done, you can open it. Use a pair of cheetle forceps.
Your hand.
Whenever you hand, hello.
Yeah, you continue, no problem.
Okay, sir.
Your hand.
So whenever your autoclaving is done, whenever you're handling these gloves, make sure you keep them on a sterile area like the sterile cloth or something. So after autoclaving, don't keep this on a regular things. So you always use a alcohol-based hand rub solution and then wear this glove, and always keep this. This is a very important step. Once you have rolled in the way how it was rolled down, and when you want to open it, it's a very simple thing. You can hold it in the outside thing. Once you snap it, it will open, like both the gloves will come the proper way. So then you can open it. So now let's see a small video about how to wear the glove and removing it. So what is the purpose of the technique for wearing a glove? See, though we use alcohol based hand disinfection solution or whatever way we can use, like a variety of techniques we can to disinfect our hands, we go for a hand scrub technique. You cannot completely sterilize your hand. There are some amount of resident flora in our hands which might be possible, like you can transfer those organisms from your hand to the sterile glove. So the glove has two surfaces. One surface is the outer surface, which is going to contact the operating field, and the other surface which is going to come into contact with your unsterile hand. That means the technique is such that you are going to touch only the inner surface of the glove, which is going to touch your skin. The outer surface of the glove, which is going to be in contact with the operating field, will never be touched by you, will remain sterile till the end of the procedure or until you remove the glove. So this part of procedure of wearing the glove is called donning. Let's see the procedure. So the armamentarium required whenever you want to wear the things. So kindly observe that before you open a sterile glove packet, you need to have a sterile area to drop it. So first open the sterile glove, drop it, and drop it in such a way that the letters will be facing towards you and it will be in a readable side. So it should not be in the reverse. So after dropping the glove, you need to use a hand sanitizer. That is a full two pushes, 1.5 mm. So this is the explanation of showing the proper um, technique so that it covers all the areas. It will take around 1 minute, so that like you need to completely rub it on all the surfaces unless it becomes completely dry, so that your hands will have a good amount of hand sanitation, will be a good completely. And also remember, the working of hand sanitation completes only when the hand sanitizer completely evaporates and your hands are dry. Just by applying the solution it will not work. And we can go think. So we take the first fold. So the first fold we have taken it up. When you open for the first fold, you see the left side and right side, and this is the second fold, and this is the third fold, and this is the fourth fold. Just you put your finger inside and hold the paper out. Now you will be able to observe the inner surface of even the paper will not be touched. Now you can see the description in that. And make sure your thumb does not touches the glove. Only the forefinger should go inside. These are the videos done by my students. I hope this has been used for their training. So these videos have been kept in the department, and they can take the CDs and view any number of times they want to train. It's for their purpose. It's done by the students. So of course, we guided them. So now this donning is over. Once you don, you have to keep the fingers locked. Now you can see the glove doffing technique. So what is the aim of glove removal? So when after operating, the glove outer surface will be covered with blood and other operators or saliva or something. The inner surface of the glove might be covered with sweat. So there you should take care the glove juice or the fluids which are present either on the outside of the glove or the inside of the glove should not be splattered to the environment. So now when you are removing the glove, you should not touch the outer surface of the glove or the contaminated surface where the blood or the saliva is contaminated. So that's the reason for that. And after this, you remove discard the glove in the proper color coded bin according to the recommendations. Now, compared to the PPE, so there are lots and lots of information available regarding how the PPE is done and how it is woven and all those things. So what we want only one thing. We want what is needed. So level 1, level 2, level 3, and all those things are there. This is how these are non-woven materials. These are basically made from like a powder form where they put it into the machine and they pressed and got the materials. And with the raw materials, like how we have a pant or shirt we want to stitch, we can take a cloth material, just we can do it with that. And these are the types how it go for the theoretical aspect, either it will be filament web or a fire web and all those things. So this is the description, like level A, B, C, and D. Like what level is required for what is it perfectly for the dentist where we are operating, and we always require a full cover PPE with the head hood. So that is what is recommended, and there are different standardizations. Always go for a see. GSM is not the only criteria to consider, like purchasing a PPE. Of course, we need to have a fluid resistant and air resistant. All those checkings are there. Though we do that, it's always advised to go for a standardized PPE with some markings like ISO standard or something like that. We can always go with that, and don't be very hasty in buying the PPE, claiming like which is cheap or which has a higher GSM and all those things. So compared to that, these are the original CD requirements. Like this has come and now the CD changes. Little announcement is there, like you need to have a hood to cover the neck and other exposed areas, so that there will be complete thing. And shoe cover, which was made initially like optional, now we all prefer shoe covers, because like we should not carry something over that. And the husband shoes comes in a full cover form also. So now the foot cover has become mandatory in my view. We always have a foot cover and discard it in a proper way. So these are the basic kit and medium kit and advanced kit for ICU, and who should use this. As these are the basic classifications. I don't want to some much time in go for the things, and we will always advocate like what whenever we are operating, the dentist should always have the advanced kit. There is no option at all. We have to go with it. So that is what I would recommend. And the medium GSM kit can be used for buddies. Who is a buddy? See, whenever you are downing and duffing a PPE, you should always have someone like who should help you to wear it. Your assistant and the operator. For example, the dental assistant and the dentist who is operating should be wearing this advanced kit with no option at all. This is what is preferred. And the front office staff and the other buddies should be can be taken up the medium kit, and the basic kit can be worn by the housekeeping workers, canteen things, and sometimes even for the patients we can always go with it. And patient attenders are preferred to go for a medium size kit if they are going to accompany, if in case for like a pediatric patient or elderly patient who would require some amount of support. So this is what the harassment should we always think of, and practically it is not possible at all. And I would like to have the donning and duffing PPE from the AIMS video. Just we'll go with that. This is the video which has been played or prepared PPE for training purpose, which has been left, and I will play it little in one and a half times speed so that we can will be able to save some time and see.
Someone has put it on the group, the video.
Yes, sir. I have put. It's me, sir.
Okay.
You all can download it and see it and use it to train your people also. We just play it. In case of any doubts, we can stop there and ask, or we can discuss it later. And I always recommend to have a Bluetooth which is fixed in case if you want to have a contact or something.
Namaste. We from Eames or unsterile. Make sure that the cuff of the glove goes as far as possible.
Your video is not being streamed.
Not being streamed. Okay.
System with the help of your body or by pressing the nozzle with your elbow to prevent any contamination.
It is not streaming from the first, or it stopped in the middle, sir?
No, till now nothing. Till now, no. I can hear a little bit of audio of the video. Maybe the bandwidth is not good enough to just stream the video. That could be.
Okay. Okay, then.
I think you can just explain. I think that's better, and then let them watch the video in the group. If it's not getting streamed.
Okay.
You
1 minute,
again?
then.
Yeah, try again. Yes.
I think I should change the video. Sorry, sir. You're sharing this. Just I will stop it and then share it again. Were you able to see now, sir?
Yeah. Now we can see.
And I would recommend to have a very thin slippers. If it is very big or bulky, the shoe cover might not get easy to wear. It will get tangled and it will be difficult for you to put it and remove it later on. Make sure you have a very thin slippers, or it's like a it's not a thick boot kind of thing. Don't wear that. Gross contamination in the sense like a blood splatter or something which is visible, or if you are noted some saliva dripping or something. See, the effort of disinfecting the inner gloves every time is to avoid the contamination of the maximum possible contamination from the PPE part of the PPE which you removed before. This is very important step. And make sure you don't put your hand inside the PPE now. Just pull the hands out and see he is touching it inside, which is little risky. You should not touch your scrub. See, in this even in this video, you can observe. See, he is touching the hood and he is removing the PPE cover. But make sure when you are touching inside and trying to get your hand out, with this hand, do not touch your scrub what you are wearing, whether not your shirt or not your pant. This is a very crucial step. If you are going to touch it, it might contaminate. See, if you see there, first he is touching the while removing, he is removing the touching the hood with the same glove what is going up, and further after he zipped down, I think you can see the smaller part of the video. So once it is done, his hand is touching the inner side of the PPE. Now again, see here, this is a crucial step where your hand should not touch this. He is touching the chair, and don't do all this. These are small mistakes in this, and try not to do all these things. Don't touch your footwear or your dress and everything. And whenever the PP is falling down, make sure only the inner surface of the PP touches that. You need to have literally, you need to have some lot of trial in doing this. Try to maximum have less number of contacting less number of surfaces as much as possible, because the same scrub you are going to wear all through the day. You are not going to change the scrub every day. Yeah, this we have already seen in the video. I think if you put so much of hand sanitizer for 1 week or 10 days, definitely we'll all have dry skin and fungal infection. Yeah, this is what we discussed the other day. We need to wipe the shoes also, which is very important because it might have some possibility that could be there. So I think that's the end of the presentation. I think we should go with the discussion. Eapen, sir, I'm
Yeah,
stopping the screen
yeah,
sharing. You can take over.
yeah. So thank you,
Yeah, can I put a question?
Yeah,
Yes,
As
sir,
Dr.
please.
Anand, can I
yeah,
put a
we'll,
question to Piramal?
yeah, we'll take
Yes, sir,
it
please.
up. We'll take it up one by one. Now we have had a detailed presentation on the type of gloves and all things like that. Now the glove, how to wear it, how to discard it. Now regarding the PP, how to wear and discard. Now we'll take up questions over to you, Anand. What was your question, please, Dr. Anand?
Yeah, I liked both of your presentations were picture
Thank you, sir.
perfect. Regarding Perumal's, let me go from the back. He told
Yes, sir.
45 GSM is enough as a basic kit, 70 GSM as a medium kit, 180 GSM as an advanced kit. Okay, the
Yes,
thing
sir.
is, if suppose we are doing some kind of examination or whatever you are permitted to do now,
Yes, sir.
I mean, non-aerosol works like
Yes, sir.
examination, delivering a crown, or doing a palpation intraorally, kind of basic things, or removing a temporary crown, or taking making an impression. These kind of things. That is non-aerosol, no invasive procedure like there is no blood or etc. No root canal, nothing like that. So in these kind of procedures, what is the role of having a 180 GSM advanced kit?
Sir, in dentistry or
Because practically I started 3 days back, and I'm just trying to practicality of the thing, like putting the entire thing for these activities is becoming very difficult. And if it is a medium kit, it is very easy to manage for these basic things.
Sir, I think the same kind of some discussions we had regarding this in our last webinar. The thing is that, sir, okay, you think you are going to deliver a simple procedure. What if the patient gargles or the patient sneezes over there, and we cannot control? Like if you are going to do a crown cementation or something, we cannot actually tell these procedures are aerosol-less procedures. In my opinion, in my recommendation also, I feel whenever the patient is there inside during these hot times, always consider even the routine examination. See, the aerosol procedures or non-aerosol procedures are one. We deliberately don't produce lot of aerosol. That's it. It's not like you don't produce aerosol during those procedures also. There is possibility that aerosol can be generated also. So to be on the safer side, I recommend like take some little more effort, take some time and go for a full PPE to be on the safer side. So that when the day and night when you go home and sleep, we all have the confidence like we are completely protected till the best of our knowledge. It is for
yes,
that
I
safety
agree with you. I agree with you. I can quote one example today I had. I was examining a 1-year-old child who was suddenly crying. No,
Okay.
so the mother has, she was suddenly crying, and it was just a hypoplasia. The patient the mother was a little concerned. What is this cavity or whatever it is? So nothing. It was just, but suddenly the child started crying. So I felt a little horrified, So what you said is really relevant over there. Now, one more thing I would like to ask.
Anand, may I interrupt in that? The child patient cried because of some hurt or worry, or seeing you put in that PP and that horror.
Naturally looking at us. Naturally looking at us. Yeah.
I think sir, we should show the videos of the doctors with the PP. The image of the doctor should be changed thereof. It's not.
Maybe 30, 40, 70 GSM. I'm using 70 GSM. Okay.
Yes,
Now,
sir.
what I'm saying is, like that day, George sir was saying, Why can't we have a medium and overall a small apron, surgical apron kind of thing, and another, to cover the chest or something like that. So in that case, I think 30 GSM inside and a 30 GSM coverall forward, which can be disposed of. That is fine. I felt in practicality. Yeah, and regarding you said all the PPE has to be discarded in the red bin. Yeah. What about the mask? I'm a little confused about that. Mask?
Sir, in this COVID times, the color coding is not followed. Consider everything is discarded. Consider everything is highly infectious and prone, because we don't know,
including tray sheets, including tray sheets and patient bib.
Yes, I recommend for the tray sheets to keep a autoclave tissue paper spread over the tray sheets. You can autoclave the tissue paper.
Okay, let me ask the other way around. Usually, non-COVID time, what about the polypropylene disposal? Is it in yellow or red? I'm a little confused.
So polypropylene disposal, is it contaminated with the blood or it is with the spread? Because this polypropylene spreadsheets, it's a spread. So that you can discard it in the regular thing only. But where you discard the tissue paper and other things? Yellow. Because if you are using you don't keep a sterile instruments over that polypropylene sheet, because that is unsterile. If you want to keep a sterile instruments, ideally you should have a sterile cloth or a sterile tray over there. So direct blood contamination over that is possibility is less. But if you visualize any contamination, you can always discard the plastic material in the where you discarding the other.
But polypropylene is non-biodegradable. Huh? Is polypropylene non-biodegradable?
Sir, the biodegradability is not an issue in discarding the waste, sir. It is not bio or non-biodegradable. It is the contaminant part. What is there? That is the thing. For example, whatever the syringes we are discarding, we are the ideal recommendation from years before only. The act of needle resheathing is completely banned. The best practice is to take the syringe with the needle, directly discard that into a puncture-proof bin. That is the ideal thing, the utmost standards. But now what we are having a needle cutter and all this. Even the dental colleges, people whenever they come for inspection, they expect a needle cutter to work, which is outdated long time before. So we cannot follow such things to happen. And the thing is, like even the BP handles and the BP blade, there are like thick containers where if you insert the BP handle with the blade, it will contain the blade and hold it inside. You need not handle the blade at all while removing. So you can discard it once the container fills. All those things happen. So always you can discard it in the don't take it like think it is degradable or non-degradable in that aspect. Sir. Always consider the infection thing. What are the protocol? You take it in that case. I can share a chart.
Yeah, I had a query from Dr. George Paul.
Thank you, Piramal.
Yeah, I got a query from Dr. George Paul, sir. Sir, what is your take on what Dr. Piramal suggested about the use of 180 GSM as in all dental settings, considering has to be very much on the forefront with the risk of COVID patients, as every patient has to see. What is your take on that and practical aspects and how possibilities and your suggestions on other alternative measures?
Sir, instead of going with GSM, I would say in a much better refined way. Take the PPE which is documented or which is approved with the standards. That will be more appropriate instead of going with the GSM values. Okay. So that would be fine.
Hey, Mahendra Piramal.
Yes, sir.
It was a nice talk. It was very informative.
Thank you, sir.
Eapen and Piramal's talks were very informative. I learned a lot of new things. Some of the things which I was using, contrary to what, to give you an example, when you double glove,
yes, sir.
In fact, I was just checking on my Google. Do you put the smaller glove first and the bigger glove afterwards? There's a very, very pertinent question, because actually you're not supposed to take one glove size bigger and smaller. You're supposed to take half a glove size bigger and smaller, which we don't get in India. That aside, I have always used the bigger glove as the first glove and the smaller glove as the second glove. You may be surprised. I was actually asked to do this by a very senior surgeon, because he said the tactile sensation is much better when you do it. So you were just actually advocating it the opposite way. So I just checked Google. while you are talking. And Google says what you said is right. You put the smaller glove first and the larger glove thereafter. But he also said most of the surgeons, 80% of the surgeons, be around.
Yeah.
I probably belong to the 80% of surgeons because I used to put the smaller glove first and the bigger glove afterwards. They say you get better tactile sensation with the other way around, and I was probably using it that way. But anyway, that was of not much significance in our conversation. So to the question that Eapen had asked, I think, see, have you started practicing, Mahendra Piramal?
Not yet, sir.
Okay, I noticed that you haven't started practicing. Anand has started practicing, and I have started practicing.
You should wear the PP and see how it feels.
you will probably change your talk after you start practicing.
Sir, that is
Sir,
why
and I would like to say, I am a person who used to sweat a lot.
Yeah, today I did 8 extractions or 7 extractions or something like that, and we saw about 24 or 25 patients in actually. Of course, many of you who know us know that we have a high volume practice. We see about 100 patients a day, but it's much, much less than what we normally see. We have many doctors also. And of course, we have frequent interactions where we actually tell them what has to be done and what doesn't have to be done, and protocol. So I was actually taking down notes while both of you, were speaking. Now, in practice, like Anand said, there are several problems. Now, you are talking about the PPE, for example. I assume you're talking about a PPE for a procedure after which you will go through all these steps and remove them and throw them into the designated
sir. But no one is coming to remove the PPE. No, the best biomedical persons are totally running away. Even during the regular times, they are not coming at all. Where we are going to dump all these things, there is a big question there.
Mahendra Piramal, I started my practice around the time when the HIV and AIDS virus was in full blow. I was I still am HIV negative. I was the only person in the whole of Salem, Erode, even Coimbatore and Dharmaburi was taking care of HIV patients for cancer surgery, for tumor resections, reconstructions, except orthodontic surgery. I think I've done virtually every surgery on HIV positive patients. It was the same situation. People were wearing 2 gloves, 3 gloves, 4 PPEs, 6 masks. They didn't look like themselves. It was a completely different picture, very quite like what is happening today. I am actually wondering in my mind whether we are overreacting to this whole situation. Like what's happening in the Norwegian countries, in Sweden and things, they have cut down all their extra precautions. They've had their hike. It is going down now. There is herd immunity. People are going back to their work. I still am wondering whether we should be telling our dentists whether we should be going overboard with some of the things that we are actually prescribing for them. So I actually suggest that we should actually get into practice to know the difficulties of using it. For example, the PPE that you used, very nice, very elegant PPE, definitely very protective, very high GSM. The doffing and donning, I disagree with you on the doffing. I'm not going to get into a thing on that here. I'll talk to you later about it. Now, there is some issue of the inside and outside, which as surgeons, we understand very clearly. We will only confuse the other people who are here. It's a different matter. So if I am, for example, I'm a single dentist doing 1 extraction, 1 filling, 1 root canal opening, another extraction, and examining a patient, etc. For maybe 6 or 7 patients. Are you actually suggesting that for each of these patients, we don all these things and doff all these things?
What's the other option we have, sir?
The other option is what Anand told you, that we have an intermediate low GSM you and the patient.
To cover that and remove it and put it up. Yes.
You throw it away.
See,
yeah, that sounds reasonably good.
If you don't want any GSM and all those high tech stuff, you can just use raincoat material, umbrella material. I'm sure you can stitch something that will be able to cover yourself well.
Yeah, in Decathlon we get a very good fine and thin raincoat, sir, which you can wear it comfortably also.
Absolutely, and take it and throw it into a wash basin which has got soap and lathered soap and thing. Wash it cleanly, put it out in the sun, and get it. I'm sure there will be no virus on that. So
Okay.
I think while we are reviewing all these very elegant PPE protocols, we must remember that most of these protocols have been developed for PPE for COVID-19 wards.
Yes,
Where they
sir.
will wear
True.
these things and wear it the whole day, and everybody is COVID-19. Nobody's going to, you're not going to pass infection from one to the other and remove it. In a dental practice, it is impossible to do this. If we have to do it at the level that you showed us, which is very good for protection, we might as well not practice for the next 2 months. I am
Yes, sir,
practicing
better.
only for one reason. I have 15 staff members, I have to pay them. And the only way I can do that is only to do that. We are not planning to make any money, make any profit, any money to be taken off. I have a reserve fund for that. This is only for paying our staff and to keep in touch with our patients. That's the only reason why we are doing it. 65 years we have been in this field, and we do not want to lose it. So what I'm suggesting to you is that,
Yes, sir.
because your talk was very good, very clear, very precise, very scientific, protocols have been observed very well. I think you should actually start practice for 3-4 days and then come back with
Then you will change that thought.
which I'm sure your protocol will be different, and I'm sure your protocol will be much more practical. And all of us, I don't know whether Eapen agrees with me on this, but
100%, 100%, sir. 100%.
we need to do that. And
This
Prashanth,
was exactly what the immunologist was telling me this morning. And this was exactly what the oncosurgeon was telling me last evening.
Yeah.
You know, we have to be practical. We are actually going overboard.
Yes. Yes.
So now the description which was given by Dr. Mahendra was superb. It was
very nice.
very informative. It was very informative, and definitely we all learned a lot, and definitely that will definitely contribute to the way we don and doff. There is no doubt.
Yes, sir.
But coming to the practical viewpoint, I don't think it will really work with our routine practice. It is the most important thing is to ensure that we protect our nose, our eyes, and our mouth primarily, and then definitely wear gloves and wear an impermeable barrier which you can reuse once it is properly disinfected. Only then can you work comfortably on your patient.
Prashanth, if you had 10 patients today and you use this protocol, you would probably spend about 10,000 rupees minimum.
Absolutely.
And you would have probably got about 2,000 or 3,000 rupees as your revenue for the day.
Yes.
So we need to really, and I think this group has done extraordinarily well in looking at the practical aspects, from every point of view. Particularly people like Mahendra Piramal and Prashanth Pilla, of course, leadership of Prashanth Pilla, Mahendra Piramal and Eapen and Anand have brought in and Varghese and Georgie and everybody else. You brought in enormous amount of information to this table, and even when the COVID goes, we are going to remember this as
maybe we'll laugh at the dumping of information. After some time, hope we will laugh happily without getting infected.
Everybody is going to remember this. I have only one more point to make. I really don't want to take time. I wanted to ask Eapen this. You're talking about reusing of masks.
Yes, sir.
I have 3-4 masks for myself, and I'm not putting them in brown paper bags. But
used ones, sir. Used ones.
I think cold. See,
used ones.
Yeah, used ones.
Yeah.
No, what I'm doing is I'm using them, as you said, alternating them and using them and all that. But one of the things I do, which I don't know, which really needs to be tested. I have a very clean place in my house where the sun shines very brightly, a patch of place. I put this my N95 mask in the sun. I don't know if it degrades. I have no idea about it. I know it's solar energy. I know there's UV light, and I keep it there for about half an hour, 1 hour. Turn it around both ways. Do you think it might work?
What would be the maximum temperature what the mask could be subjected to?
Salem's temperature today is about 39 degrees centigrade.
50 to 60 degrees centigrades of steam is the what temperature recommended by CDC for reusing in the method what I told you,
Oh.
50 to 60 degrees centigrade for 15 to 20 minutes. If you're taking a microwave or if you're taking an oven, you take some water with the temperature set to 60 degrees, you're creating some steam. On top of the steam, if you just keep a filter like thing and keep the mask, 15 to 20 minutes of exposure to that steam at 60 degrees centigrade. That's why I asked you what would be the maximum temperature of the sunlight.
Yeah, but you also mentioned UV light. So you
Yes,
think
sir.
this
UV light,
would
sir.
not compare with UV light?
Definitely of the wavelength 250 to 300 meters.
Okay.
250 300 nanometers, because that is not what the sunlight wavelength is about. So we are talking about a wavelength of 250 to 300 nanometers.
Everybody talks about the non-viability of this virus in sunlight.
True, but
Not
then
even
definitely
not even for 2 minutes, they say.
Yeah.
Yes, sir.
Dr. Eapen,
Yes, sir.
Eapen,
Yes.
actually, I had one or two questions for you. In your presentation, you said UV chamber can be used for placing the mask. Is it one mask at a time? And what is the duration of using UV chamber with respect to N95 mask?
Two
How much
questions.
duration should you use?
One is how many masks can be kept. Now, in a UV chamber, depending upon how many shelf you have, because your regular instruments, you can actually, dentists have this UV chambers in the clinic with two tubes on either side. Okay, each space is 6 inches on either side, and the shelf 4 or 5. So each shelf you can give how many now, as long as you don't overlap one over the other. Okay, so there is both sides exposed of the UV light. Okay, and your mask is getting exposed. So that's not a problem. Any number of masks. Duration 6 minutes is what they say in UV chamber.
Sir, can I add?
Okay.
And but the problem is, and if you are exposing it to UV, the maximum number of times you can use it only 3 times. That's the CDC recommendation. Because what happens after that is that alters the static electricity of the filter barrier. So it won't.
So let me add, because it
Please,
was something which a webinar was happening from Melag, from Germany, and from 7:30 to 8:30, and I logged in just after that, and they had recommendations from Austria and the Netherlands, where they say in steam sterilization after you pouch it, it's perfectly all right to reuse masks. So
That is autoclave at 15 psi.
Autoclave is contraindicated.
So that is based on CDC, but this is from Austria and Netherlands, but German authorities are not allowing it. Austria and Netherlands are allowing it, and what they say is it should be a gentle cycle. It's not the normal cycle, but a gentle cycle. But it should be pouched and then it should be used, and that is one thing which I would like to say. And the second thing is about the custom fit of masks. There are people are 3D printing their face, the outline of the faces, and using 3D printed templates to make sure that frames for N95 masks, and they're keeping on top of it. And another point which I'd like to shed on this is whether it is effective or not is to be found out, but 3M has a fabric conditioner which can be sprayed on top of normal fabric to make it impervious. So it is like what usually after scrubbing of our furniture, so they usually spray it for keeping it for 9 days.
Let me comment on that.
You had the same with that Loyal thing which came out. They have applied a material over it, and the filaments are also antimicrobial, as they claim. So we don't know, these are claims. So
there was a fabric spray on top of 3M. This is just a suggestion. So if you're using 200 rupees surgical gown with a spray, it is much more cheaper than using a 3.
True. Now let me answer your suggestion
but
about
if
that.
you use a spray to clog everything, how it will will be able to, air will go in and out.
Piramal, let me tell you. Now the answer to this, can you hear, Varghese? Can you hear me? Okay, now there's 2 questions what he said. One is about the use of autoclaving. Now, the CDC and the OSHA, the American guidelines, are actually basically totally against the maximum temperature with steam to expose this particular mask without deterioration in the filtration and the static energy is only 60 degrees. So that is why they have told not to do autoclaving, because the studies what they have done has come out with deteriorated property when this is being subjected to autoclaving. They're not just telling like that. They have subjected this to autoclaving and they have found a temperature of 60 degrees. They have found a temperature of 60 degrees of moist heat worthy enough to use the mask up to 20 times, without spoiling the property. Now, any temperature more than that has been shown to reduce the property of the mask. Now, second thing regarding spraying that thing and making it impervious, definitely it will make it impervious, but it won't disinfect. What we need is a contaminated mask to be disinfected. And we also need the portal of entry for the intake of air and the exhalation also. So that agent, what you said, could be...
Sir, it's not for mask, but it is for the gowns. Surgical
gowns. Oh, gowns.
I think the gown. I think the gown is superfluous totally. If you ask me.
Gown, any disinfectant. See, if you are using a non-woven with a laminated property gown, even if it's in the range of 70 or 50 GSM, that would be good enough as long as it can retain the barrier. See, basically, simple thing is now a thin gown in terms of lamination or a non-woven fabric with a laminated layer. And if you put a regular that 20 rupees, 25 rupees, you get this PVC thin disposable apron on top. You put on top of it. Okay, and after every procedure, see if you're doing the exposed portion, if it's if it's a spoiled mean, then definitely you have to remove it. If it's not soiled, if you just have to remove this outer part sheet and then you can use, because that's cheap, that 20, 30 rupees, you get that small, I'll put a post in the image in the group also, you get that to buy. You keep on changing that. So main ground inside, as long as you don't do much of aerosol work or aerosol work. And if at all use also, if you have a proper barrier in the form of a shield, and if you use of your mouth, your so-called your rubber dam inside, your aerosol what is going to be created is also not communicating with the saliva. Your entire tooth and everything is separated from that. And a high vacuum suction. That itself will reduce the amount of your aerosol. Never put the ceiling fan while working with the aerosol. So these are things which you can retain your aerosol to within 6 feet distance, beyond which it may not be carried. So the gown, if it is as long as it's an impervious, a full sleeve gown, okay, and the face shield and the mask to protect yourself, an N95 mask will be good enough. Actually, it is now even the presentation, the same presentation was done by Dr. O.P. Kharbanda, the one part of your ICMR. Even he suggested the use of 70 GSM because 180 GSM is for those people who's working in the COVID ward and who's actually directly dealing with the COVID patients. Now we are having the possibility now, like what we said, as long as we don't know anyone, we should actually consider them as COVID positive. That's the scenario right now it is. But they are not actually proven people. But even then, if you take the basic aseptic precautions of the hand hygiene and the tea area precautions, plus avoid your exposed part of the body to prevent getting soiled with any sort of debris, and with the disinfective type reusable material, that's fair enough, good enough, in my opinion. That's what I'm telling you.
And another part I'd like to add is on personal hygiene. Mask wearers should not have beards extending beyond a point. And then I think you are safe, sir, because that's one of the recommended ways of having a
Maybe you've got to trim it a little more.
And secondly, and another point which I'd like to make is, since shaving creates micro cuts, I think it's safer to shave in the night, not in the morning before going to the clinic.
See, Varghese, I went through a lot of literature on actual spread. Apart from the nose and mouth,
that is it.
No spread. Okay, even the conjunctiva that Eapen spoke about is very minimal, and there are very few reported cases. In fact, they say hand hygiene, extreme hand hygiene, can actually produce micropores, which can technically allow the viruses to get in. Even if it gets in, it's not going to the receptors where it's going to give you a COVID-19 infection. So I think your mouth and your nose are absolutely important. Your eyes is secondary. Splashes everywhere else is only relevant when it comes to spreading it to other people and taking it home. and other people and taking it home is very important. So therefore, we need precautions. And the virus going in, for some reason we think that the virus goes like an arrow and goes right through and gets into your nose or mouth. It doesn't. You talked about Brownian movement. Viruses have random movements. So a 0.1 size micron virus will need at least about 8 or 9 microns for it to be effectively able to get into these things. That's why a 0.3 micron is, permeability is perfectly acceptable for a mask. And even the droplets, unless of course we go in the droplet form, but the droplet form is very big. So I think N95 is much more than important. An N95 with an additional 3-ply mask is doubly
make it perfect
for you, for saving you.
Yes, sir.
What I
face
do,
shield, face shield, sir. Face shield must be.
My doffing is I just remove all my clothes, have very well lathered soap, water, wash, change into a new set of clothes and go home, because I have a grandson and my family and my mother, my 85-year-old mother and things like that. So being concerned about that, I do that. But I think this whole business of PPE as being central to our practice, I think is wrong. We have to have much more practical thing for the dentist.
Can I ask one more question? Dr. Eapen, like you took N95 mask for the dentist. What about my second hand and the third, third and fourth hand and the fifth and sixth hand? My second, my
assistant, first assistant.
Second assistant.
First assistant and the second assistant. What should be there?
I think
your assistant, whether it ranges from 1 to 100 doesn't make any difference. The procedure, what you do is what makes a difference. Any aerosol anticipated procedure.
Present procedures which are accepted regarding that.
I'll tell you. Any aerosol anticipated or any aerosol generating procedures, the operator as well as the assistant should be equipped with all measures to prevent any sort of aerosol entry to the so-called T area. At the same time, a face shield, wearing the so-called, and the protective gowns and the exposed area covered. That applies to whatever the assistant, whoever is in the danger zone of 6 to 10 feet in and around the area of operation where an aerosol generating or aerosol anticipated procedure is being carried out.
Sir, if there is no aerosol.
Anand, I'm still going by my old stand that we should not be using aerosol. I know it was not inconvenient.
Now my question was related to the present things which are permitted to do.
No problem.
That is non-aerosol procedures.
Now, if it's a non-aerosol procedure, basically when you operate, whatever measures of safety you are adhering to as per the norms and whatever we call it as minimum recommended, the same thing is applicable to your assistant if that person is assisting. If she's moving around, it's different. But if she is assisting that patient and having the same sort of exposure like what you're having, the same set of minimum recommended precautions is applicable depending upon the type of procedure. As of now, no AGP procedures. So the regular surgical mask, a face shield, proper glove, impermeable gown would be good enough for both of you.
Yeah. Next thing is to everybody. See, now I found that soap solution is very important. First wash material for all my examination, mouth mirror, probe teaser, or the tray, or whatever it is. So, which is the best soap solution commercially that we can procure? Just your suggestion.
I can recommend something, sir.
Yeah, please.
Which is the best paste, Anand?
Why I'm asking this is, that's fine. No, why I'm asking this is, in the recent video that was published by one of the nurses who has undergone training for Nipah virus and COVID from specific government bodies, they were trained. And she was telling they were using Lysol in government hospitals. They were using Lysol 10 ml, okay, and dissolved in a specific amount of water. And they were spraying that over the PPEs, over the used instruments and for primary washing, first soap wash. So
no, see,
regarding Lysol.
Lysol is not a soap solution.
not a
Lysol
soap.
is basically a phenolic compound. Like how any disinfectant act, it's basically a low level acting disinfectant. So that mechanism will, that way it will act on the virus, but soap is acting in a different way. It reduces surface tension, it reduces the stickiness of the virus, it breaks down the lipid complex of the virus, which is very sensitive. So any soap solution will actually work in this particular case of killing the virus. Plus, if it's medicated, the added advantage of the germicidal property of that ingredient also will add on. That's all.
The lathering property of the soap
Lathering, I
solution
think,
is the most important.
I think any
So
soap,
that's what I was
Enough lather.
I was feeling.
I have a
practically when I was
recommendation to
using
make here for
soap
this.
solution in the hand wash. Do you think hand wash?
And Piramal wanted to just add on something. Just Dr. Piramal, please.
Sir, in this regard, if you want me to comment on the best solution to dip the instruments post usage, I would recommend
hand wash. No, he asked about hand wash.
Hand wash.
Yeah.
I recommend Bactolin 5.5 soap. It is from the same body company.
So what
who
is
is manufacturing this sterilium? It contains the pH altered solution. So if we, though we want wash it for a number of times, it won't get dried. It has a good amount of skin emollient. I am very much in favor of that.
So is it a hand rub or a soap? Is it a soap or hand rub?
Soap.
Mahendra, all soaps contain emollients. All soaps contain, there's a standard.
Yes, sir.
Yeah, so all of them have it. So
but I think the point here is what soap solution to dip the instruments post usage.
Exactly, that was my question. That was my question.
I would recommend a solution called 3M Rapid. It has lathering effect. It can dissolve all the blood and organic matter. It is an enzymatic dissolvent, and you can use the same solution mixed with water in ultrasonic cleaner also, and simply you can use the same solution as your regular Vim gel. You can mix it with the water, it will lather, it will cause enzymatic cleaning. It acts as ultrasonic deterrent also. I think we need not compare with the one what we used in the GH. So this is a diluent solution which a little amount can help. You can always have a pre-prepared solution, directly dip the instrument inside that, and you can go with it.
Anand, your question is out of syllabus actually. So these questions actually we are all coming into the next module now. The next day, Dr. George will talk about
because it was practically very important. I felt that's why I asked.
Let me just tell you, the Dr. George Paul is going to talk about front office. Then one of us will be talking about interoperative. Then managing instruments. All these will be coming. Don't worry about that. But let me just tell you one point regarding the hand hygiene and the wash. There is a feeling that whatever you do, wherever you are, how soiled your hand, you just take a tube that pushes off that alcohol rub, and you clean, hands are clean. But remember, that is wrong. Your alcohol-based hand rub is applicable and effective only if your hands are not soiled. Whenever your hands are soiled with either dirt or anything, you have to wash it with You have to first wash it with the soap, and then only your hand rub will act. So alcohol-based hand rub, never ever try to use if you're in between patients, fine, because you have already done the washing once, and then just wash and dry and straight away you can use. But then if you come from outside, somewhere, anywhere, if you walked on something and come down anywhere, immediately you have to wash with soap, dry, and then only put your hand rub. Otherwise, what's going to happen is you will get the psychological feeling of taken the hand rub, but this hand rub won't act direct on the skin because you have a layer of mucky or dirt in between. So always make sure if your hand is soiled, soap solution first, then hand rub. In between chair positions, in between patients, just simple washing of the hands with some water and hand rub will be sufficient enough. Okay, just remember.
There is an important thing to be added between the hand washing and hand rub solution, sir. That is drying the hand completely. After washing, you need to dry your hand completely. That's why I recommended autoclave tissue paper. You can take a sterile tissue paper, wipe it. Do not use reusable cloth towels. You can autoclave the tissue paper, keep it in a bin, take it, wipe it in the hand, dry it, and then go for hand sanitizer. If you apply the hand sanitizer or the alcohol-based solution on a wet hand, again it is going to create problem. Even if you use a hand sanitizer, you have to allow it to dry. So after washing, drying the hands completely, then hand sanitation.
But why do you want a sterile paper for that? Because anyway, you're going to wear a sterile gown later. You're talking about after washing with soap water
Yes,
dry.
yes, yes,
But why
yes.
do you want to have a sterile thing on it? Because
Two
you're going to
reasons,
put
sir. Two reasons. We are washing the hands thinking that we don't want the hands, we want to remove the soil from our hand. One, sir.
True.
And by using a reusable cloth, we don't know where it is washed, where it is lying down, how it is
sterile.
folded.
It's not about sterile.
I'm talking about sterile tissue paper. Why did you specify sterile? Why not dry? Because anyway, after that, you're going to put the hand rub and then you're going to wear a clean glove. You are not even going to wear a sterile glove always. For examination purposes, you're always going to wear a clean glove only. So why do you want to have a sterile tissue paper?
See, these cloths, after you wiping, in case in foreign countries like
we're talking about the you
tissue paper, sir. Tissue paper, sir. If you go and see in a tissue paper unit how it is manufactured and packed, then we will not maybe probably tissue paper is like I prefer to have a tissue paper which is autoclaved and kept. That is my preference. The reason is that I don't want to have any other contamination from there. Of course, you're thinking if you use a hand sanitizer, it is going to remove all everything. So that is fine. My point is make it dry with the tissue paper, preferably a sterile one.
At the end of all this, Mahendra Piramal, when you wash your hands, you are only surgically clean. You don't have a sterile hand.
Sterile hand, true, sir, true. True fact, sir.
I mean, I think tissue papers would be, surgically clean at least, definitely.
Okay, sir. You are telling a regular tissue paper, unautoclaved ones.
Yeah.
Because
that's fine, sir.
See, even after that,
before you eat and
yes,
everything
else. Yeah, true, sir. We can use the tissue paper also.
See, even after that, when you wear a clean glove, you don't know from what source this has come out. You don't know how these people have made it. That is also an unsafe one.
Exactly.
I
had actually that also question. The PPE that we are getting, is it sterile? No. It is
need not be.
Just a gown. That's all.
PPE, see, unless you are doing any invasive procedure, do not require any sterile things. That's number one. Please keep in mind. So don't waste any procedures, any money on that, unless you do any invasive procedures. As far as an examination glove, again, other than any surgical procedures or where you come in contact with the blood, examination gloves or double gloves is more than enough. And examination gloves is not a sterile one. Okay, you can use a regular use one, but then definitely after wearing it, it will be a nice habit to just wash it with soap. Two advantages. One is basically something like you're sanitizing in your hand. You're actually rubbing and washing the glove, which is actually getting sanitized. Number one. Second, the dirty stink of the latex also will be just replaced by a little bit of fragrance of the so-called soap what we're using. For two simple reasons. That's all. So if you just wash your regular examination glove after wearing, that would be more than enough.
Okay. So coming to this, sir, Judge Paul, sir, the other day you were asking about using microwave for sanitizing the N95 mask. You got the answer.
I have not tried it. I just,
sir, I have got a very interesting article for you. Can I share a screen?
Yeah, please. No, you can tell the inference, sir. You can tell the inference, Mahesh. No problem.
So the inference is there is a study that recently published in this month, May, which April, it tells like by using keeping a small plastic container box which is microwave shielded, you can keep a small bit of tissue paper which is damped with water. They tell humidity and microwave temperature at 85 degrees for 10 minutes. The mask have been reused or reheated for 5 times, and it has been successful to found that the efficiency is not been altered.
Yeah, that's what Eapen said.
Yeah, the same thing. Yeah, that moist heat.
I was not there for that, sir. Maybe I am repeating that. Sorry.
Mahendra Piramal, I have a small doubt. See, I have one with a respirator, the valve.
Yes, sir.
Will the microwave melt that part of the plastic thing?
In this study, they used the mask without the valve, sir.
No, see, in this article, what I suggested, that link about CDC and OSHA, the proposal, they have suggested that you could come across with little bit of spark in the microwave chamber because of the presence of this aluminium nose clips. That is not a problem. The temperature is important. Moisture presence is important. Never do a dry radiation. You should have a moisture. The temperature of that should be in the range of 60 degrees. 10 to 15 minutes of thing will be giving you adequate disinfection of the mask without compromising the quality of the mask.
So small doubt here, Eapen. You said steam, but you will not get steam at 60 to 70 degrees.
Now that's see that whatever the close container. See, that's one point, logical point. 100 degrees is the boiling temperature of water, then only steam comes. But the moist heat, whatever we think, that's what they suggested. So those are things, even I thought about that when you said about it. How can we come steam with that? 60-degree temperature, whatever the particular humidity, maybe that vapor, whatever it comes, is what they said.
I have shared the article regarding this, whatever I have mentioned in the group, sir. I think you can have a look at that.
Yeah.
Yes, sir.
We're getting a lot of information. The problem is we are on information overload. We don't.
Yes, sir. True. We are information bombardment, actually.
But these discussions, I think these discussions bring a little more practicality. Yes, Karthikeyan.
Yeah, Karthikeyan has a question, please.
You can unmute yourself, Karthikeyan.
Unmute yourself.
Yes.
Karthikeyan is already unmuted.
So when we take precautions for doctors for PP, should we take from preventing aerosols from falling? Should we see that patients don't get infected with the aerosols when doing the procedure, sir?
Sorry,
patients
for that
when you do a procedure, we put PP to prevent aerosols from contacting the doctors. But at the same time, when it falls on patients, will they not disinfect the whole way? When they go to the clinic, they'll infect the whole way.
Absolutely.
Yeah.
So that's exactly what I'm saying. I'm saying, however much PPE you wear, you are still allowing your patient to walk around with the aerosol. They're going out.
So what you do to prevent the patients? So we just put a cover. I mean, just
some things are impossible today.
Sir, Karthikeyan, now may I answer you that question?
It's not by hospitals. Of course, it is by hospitals. It is by vegetable vendors. Who are not following any of these things. So, I think we need to be, it's a good question, very nice question. What do you do about them? Are you going to
I'll answer that, sir.
I need to have a beautiful answer for that.
I answer that, sir. Because Karthikeyan was telling about the patient's aerosol. Now, if we are taking protection for ourselves, then the only possible person who can actually spread is the person or the patient on the chair. He is already positive. Then what is wrong if he takes his own aerosol and go back home?
No, sir, he'll go to the reception to pay the bill.
My question is,
subsequent patients who are walking into the clinic. He's talking about the subsequent patients who come into the same.
True.
So the aerosol remains in the air, isn't it?
That you have to do the disinfection around the chair.
No, the patients, the patient
for the patients
will go out with the aerosols to the reception, pay the bill, and on the way they go touch the doorknobs, everything. So all the area will get disinfected.
Fine.
So it will get infected. Next patient walks in touching all the so will they not get?
Yes, sir.
So what
your concern will be answered in the clinic protocol, sir.
Yes. All points for that will be there definitely. So let's keep waiting for that. There are answers for that.
I think as the coordinator, I think we've really crossed 2 hours. It was a fantastic discussion that we had. I really appreciate the wonderful presentations made by all of you. George Paul sir, what do you think? I think we should wind up now because otherwise people will just not.
I'm sleeping. I've been drinking water, okay, in case.
No, that is an empty. That's an empty glass. That's an empty glass. We don't know what was there inside.
It is water.
So I think we should wind up. We'll meet up day after tomorrow. Thank you all. And
no, one Prashanth, there was a question in that should be answered because there was someone who asked when I talked about the type of mask and N95 and things like that. They asked one question because the compressor will have some sort of air inside. Sorry, oil inside. So the air what is going to come will be a mix with the oil and the water. So isn't it better that we go for either the R type or P type of the mask? Because I told 3 type of mask, okay, as respirators. N type, wherein because it's called not resistant to oil type, and the R type is resistant to oil, and P type is the maximum safest. So what that person was asking is whether, since shouldn't we consider the presence of oil in the compressor also, so shouldn't we actually taking precautions in a higher grade rather than N95? So there's no harm in taking, but N95 is good enough to take up because not only just oil based, even if as aerosol also it's good enough because 10 microns is the average size of an aerosol.
Oil free now.
All compressors are oil free, sir.
That was what I was coming to tell you.
No, that's what when the company makes
oil free compressors.
True.
Now, and you've got to have filters. You've got to have excellent filters, which will ensure that you don't allow oil to come in. So I don't think that question holds any relevance at all.
Now basically, N95 is more than enough. Compressor. N95 is more than enough. That's why.
I think I'm going to say good night. I'm an old man.
Yes.
I told already good night.
Sir, we will not
for
permit you to
contributing
grow
and thanks
old.
for being with us.
Okay. Bye
Thank
bye.
you very much.
We'll
It
meet
was a
up day
pleasure
after.
being with all of you.
Thank you.
And I think these kind of brainstormings are probably much more important than these webinars where one person comes and lectures and says all things.
Yeah, and I will be sharing my whatever resources in the group as far as this recontamination of the mask and things like that.
Dr.
I'll be
Eapen,
sharing that.
Dr. Eapen,
Both of you,
sorry.
both of you. Eapen
Sorry,
as well as Mahendra.
just my practical one small doubt. Can we use ultrasonic cleaner during this time?
For what, sir?
Why not, sir?
In
Why
an
not?
ultrasonic bath, water bath.
Why not?
No, for what? What is
Why
that?
not,
That's for
No,
instruments, no?
does it create any aerosol?
No.
Ultrasonic, when you on it, you need to close the lid.
You're sealing it
Closing the
completely.
lid,
Why are you
yeah.
using it? You're
That's no
covering it
problem.
and then using it. So why do you? What is the problem? There is
Okay,
no-
I'm just asking my practical doubt.
No problem.
No issue, sir.
Yes.
Okay.
Okay.
So
So
we'll
thank
all
you,
meet
thank
day
you.
after tomorrow.
Thank you very much.
And post your doubts. Post your doubts.
Yeah.
Yeah,
And I
post your
request
doubts,
both,
Eapen.
I request both Eapen and Mahendra to please share the gist of their presentations because it was extremely useful today.
Really
And
useful.
yeah, very, very useful. All of us learned. In spite of being
you, sir.
surgeons, many of us, we've all learned, we've all picked up a few points. So please put up your presentations in the gist of your presentations. Thank you very much.
Yes, sir.
We'll meet up day after
Welcome.
tomorrow. Yeah?
Okay.
Thank you.
So
Thank you.
that time we'll discuss about front office, where Dr. George Ponsal will be leading the discussion about front office management, the screening measures, and related to that. So just looking forward to that. Okay.
Okay. Okay.
Yeah.
Thank you.
Bye bye.
Thank you. Thank you, sir.
Thank you.
Bye, sir. Thank you. Good night.
Bye.
Bye.
Good night.
Bye bye.